Dr. Parikh, from a medical perspective, do you believe a partial lockdown of the kind that's being mooted at this time will serve any purpose? Will this break the chain of transmission?
Yes, it will undoubtedly serve some purpose, but it's important that we understand what that purpose is. It allows hospitals a respite. It permits some time to build up our resources, and of course, breaks the transmission chain to some extent. But beyond that, it is not the panacea that it is made out to be. But if I may, Rahul, just a couple of observations based on what I've seen on your program so far. I wonder if you ever imagined in your career that you would be the lead in a news story which said that the good news is there were only 26 deaths today. It's important that we realize John Donne's words that every death diminishes us. And there are too many people who are dead and many, many people who are dying. I'm almost reminded of Vikram Seth's poignant poem, A Doctor's Journal Entry, which describes very evocatively the devastation of war on ordinary innocent people who have had nothing to do with it. And this time we're seeing the devastation on simple people. Your images are bringing them alive into our lives in a sense, and we're seeing that people, for no fault of theirs, for many things that could have easily been avoided had we learned something from history and from the current pandemic. People are losing lives. And so it's indeed a sad commentary on us that, we almost have to be a bit celebratory that only 26 people have died.
Dr. Parikh, can you give our viewers a sense of the morale amongst the doctors and the health workers you work with? Some people I was speaking to in Delhi said that now, because there have been instances of dozens of doctors getting infected at the same time, despite having taken the second dose, it's really spooking the medical fraternity out, and they themselves are concerned about their own safety as they deal with this pandemic. How are you dealing with that situation?
Rahul, we're coping with it. That's what we've been trained to do all of our lives. As medical students, we have done 48 hours non-stop emergency duties. We are prepared for that. But what really pains us is not what we are going through, what we are seeing in our patients, in our relatives. And beyond that, it really pains me personally to see the responsibility for this being dumped on innocent citizens. That's like saying that the victims of Hiroshima are really to blame. They should have heeded the alarm. They should have known better. They should have headed for the basement. Why were they out on the streets when the atom bomb fell? Alan Rene made a beautiful film called Hiroshima Mon Amour, in which he showed that the tragedy in an individual's lives is as poignant as in that of a city or a nation. If we learned to appreciate that the lives of our citizens are way more important than petty politics, than in blaming people, that would lighten the burden on us. But to see the way people are suffering, their suffering is far, far more in comparison to ours.